Hello, this is Robert Rickover. I'm an Alexander technique teacher in Lincoln, Nebraska. I teach also in Toronto, Canada. My guest today is Robert Leda, who is an Alexander technique teacher of many years in the Boston area. And we're going to talk today about his recent knee replacement surgery and how the Alexander technique has helped him to recover from the operation. And Bob, we're going to call you Bob today.
Yeah, that'll
right?
be good. Yeah.
Bob, welcome to the show.
Great.
And good to talk to you. It's been many years since we've chatted. Could you begin by giving our viewers, our listeners, a short description of the Alexander technique?
Well, I'll give you the one sentence description that I use when people ask me, and that
Okay.
the Alexander technique is concerned with how you do what you do and who you are when you do it. And we
Perfect.
just take
Yeah,
off from there.
exactly. It's about process.
Yes,
It's
absolutely.
about
Absolutely.
process. So, from talking to you before, it's been now roughly 7 weeks since your surgery.
Yeah, that's right.
How are things going?
They're going well. I mean, I'm a little frustrated because I want to do more.
Hmm.
But tissue takes time, and we have to live with all of that. But I can, go up the stairs, down the stairs, ride my bike, do all of that kind of stuff. So that's very encouraging.
Oh, that's pretty good.
Yeah.
So you're an Alexander technique teacher, as
Yep.
we mentioned. How have Alexander technique ideas and principles been useful to you in this particular instance?
Well, I think the um, one that's sort of the most that I got the most mileage out of is that Alexander work is about the whole person, the whole
Hmm.
self.
Hmm.
So it's not so much that my knee is healing, it's that I am healing.
Hmm.
And
Hmm.
that, yes, there's a tremendous focus on where my knee is, no doubt, but it affects all of me. And I've been struck by how expensive, as far as your physicality is concerned, how expensive it is to heal. It's a very absorbing process. There's not that much room for, or as much as normal for creative thinking, or
Hmm.
doing this or that. It's the energy of yourself after such a, serious, a trauma is too strong a word, but I'm going to use it. A serious trauma goes into replenishing yourself, and you have to accept that.
Hmm. And were you able, like initially, the first few days or first couple of weeks, to actually directly apply some Alexander technique
Yeah, that was when
self-direction
there
or?
was a very that was when there was a very big payoff,
Hmm.
because what they want us to do is start moving immediately.
Right.
The rationale for that is and there's pain involved, and and they know that. But
Hmm.
what they're trading is pain at that time for the not developing scar tissue later on. So it's
Right.
something that
Right.
really pays off in the long run.
Right.
So the with such an amount of pain involved, there's for me a tendency to sort of stay away from it however I can, right?
Yeah. Yeah.
Um, the more I was able to count on the support that I get from my surroundings and from gravity and connection to the greater world, the more I was able to very gently breathe through all of this, the faster my recovery seemed to happen. What the nurses and physical therapists were telling me that I wound up getting rid of crutches earlier than expected, getting rid of my cane earlier than expected, that kind of thing. And I think it was the focus on all of me, not
Mhm.
just my knee, that really helped that. I mean,
And
I
was
can give you
there
some
any,
physical examples if you want them.
well, before you do that, was there
Yeah.
any specific thinking process that you could share with our listeners that would give them some idea about what you mean by focusing on all of you
Oh,
and your surroundings, I assume, as
okay.
well?
Yeah.
Yeah.
Yeah. When you take a step up a stair,
Mhm.
right? And you're supposed to lead with the old knee and come back downstairs with the new knee. Well, when you take a step on a stair and your foot meets the stair, you can either tend to sort of brace on it like so, right?
Mhm.
Or follow through with it and spring off the stair so that you can move the other leg. And that connection to springiness
Mhm.
and the support of the stair, rather than trying to make all the support come through my leg, I think is a perfect example of what you're asking. And
Mhm.
it's much, much, much easier on the leg and the rest of you.
Mhm. So would you use a direction, an Alexander direction in that
I
process?
don't. I don't. We won't go into a long discussion about that, but I believe those directions are inherent. So I listen for them, absolutely.
Mhm.
And I listen for what grace I have, uh, even though I'm in agony and stuff hurts and stuff is injured. So I
Mhm.
try to let that grace guide my movement and have energy come up through the center of my head so that I'm,
Mhm.
kind of pulsing like this all along.
So it's
So it's
it's
more of
kind
a,
of an indirect Alexander technique,
yeah.
self-direction process.
Yes, yes. It's tapping into it rather than trying to evoke it through language. Yeah, absolutely.
Right, right. And I think you mentioned some specific, I guess we could call it thoughts or procedures you use.
Mm.
Could you say a little
Well,
about those?
here's one interesting one. Yeah, it's a very peculiar feeling that you get, at least that I got after this knee replacement. It's like somebody put a bowling ball in my thigh. There's
Mhm.
this big, big, big blockage. And the physical therapy exercise that worked the best for me was getting onto an exercise bike. And so you're
Mhm.
spinning around like this.
Mhm.
Well, I still have a bowling ball in my thigh. So there's a point when I'm moving, when I'm pressing up against the bowling ball. So rather than trying to sort of stretch it or push through it, what I did was let the force that hit the bowling ball spread throughout everywhere,
Mhm.
rather than having it all concentrated in this place where I was feeling resistance. And the effect of this was that the bowling ball got smaller and smaller and smaller, but it was still, allowed to be in place because the swelling was doing something for me. Uh,
Sure.
and but I tried to sense the effect in as many places as I could, so it would all get dispersed. Did that make sense the way I was saying
Yeah,
it?
well, I mean, perhaps another way of describing that, and let me know if you would
Mm,
agree, is that you were consciously putting your attention on all of you or a large part of you as you were doing that. Whereas, as you say, the temptation would be to focus on this lump, or
Yeah, right,
because
right.
that's where presumably the any pain that was there would be most dramatic. But you're
Yes.
saying by focusing on your whole self more, it allowed that pain to dissipate
It's,
to a
yeah,
certain extent.
much better said than what I said, Robert. But yes, that's right. That's right. That's right.
Right. Well, I mean, that's kind of that's a kind of an Alexander technique of ish approach
Oh, I
to
think so.
your
I think so.
situation. Um, so, and some other things that you
Yeah, let
found
me,
that
okay, but
were
let me
helpful.
add something to what you said there. And for
Uh,
those of you who are not familiar with it, in Alexander work, at least the way I approach it, we see things directly. You know, I feel the pain. I know there's a bowling ball there, but
mhm,
we intervene indirectly. We try to
mhm,
intervene through the integrity of the whole and then see what happens. So what Robert and I have been describing just now was all part of that.
mhm,
I want to go back to the time when I was in the hospital. There was a device that was under, here's my knee, and there was a device underneath it like this.
mhm.
And I had to every hour pull on this device 10 times so that my leg would go up and down.
Uh-huh.
And you know, everybody's leg is pretty heavy, you know,
Yeah.
and I was doped out of my mind, you know, trying to pull on this thing as well. But once again, if you get drawn into the action, you'll hear some Alexander teachers talk about narrowing into something. So I pull like this. It was really hard work to get my leg to go up and down.
Mhm,
If I had the fullness of my arms springing out through here and pulled like that, yes, it was much easier, even in my stupefied state, which I was at that time, to do what the doctors wanted me to do. So that's more of a body mapping visualization type of thing about working
right.
with your arm
Right.
structure, but it had immediate beneficial results.
Or maybe another way of saying that was your arm. It's not really your arms that need to do a whole lot of work. They're more like
Yeah,
conduits,
yeah,
and
yeah.
the bigger work is in your core, in your torso, let's say.
Hmm.
And by shift, and that's pretty good advice for anyone using their arms for anything,
Oh, absolutely, absolutely.
Alexander technique wise, or just in general. So that's, and I would imagine that shifting of where your idea of where the work was coming from, which is all of you, made the not only it easier to do the movement, but probably made the movement a smoother one.
Yes, it did. It did.
And
You know,
and
because
that was
there's,
probably good for the purposes that it was designed to do. Yeah.
yeah, on a really mundane level, the less squeezing there is, the more oxygen can get through too. And I mean, you need the oxygen distributed through your bloodstream so all the good stuff can go in there and get rid of the bad stuff and ship it out.
Right.
Yeah,
Yeah. Mhm.
yeah,
So once you were out of the hospital and back home, I know
yeah,
you posted a picture of yourself a few days, I think, after
yeah,
the operation. So you were doing stuff around the house,
yeah,
walking, cycling, and so on.
yeah.
What are some other ways that the you were able to make this whole recovery process smoother and easier?
All right. Well, there's a really, I think, intriguing one that came up. The muscles in my leg down near my knee had been adapted to protecting my knee for quite some time.
Sure. Mhm.
That's what they knew how to do. And they kind of didn't remember how to do anything else.
Right.
So there's this period that I'm still going through, a period of sort of retraining, readapting, relearning, to get them oriented more around movement rather than protection. There's
Mhm.
the psychological and emotional sides to that, and there's the physical side to it as well. So what I did there was try to be as free and easy and deep with my head and spine as possible, and let my system figure things out.
Right. Yeah.
My job was to be very clean with my head and my spine, my conscious job. And the
Hmm.
rest of me was to suss out what to do under the new circumstances. My leg has been changing shape because it was really swollen at the beginning, swollen much less so now. And as the swelling decreases, for a while, the pain increases. The swelling is there as a protective thing. It's like having a splint,
Hmm.
on there. And I had a situation, it'll be about 10 days ago now, where I got all psyched because I'd been riding on the exercise bike and I was going to ride on my regular bicycle outside. And I did that, but it was too soon, and so I had to go back a little bit, go back to the exercise bike, be easy, 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 gentle, 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 until the tissue and the muscles could really reconfigure themselves into what was necessary. I rode my bike again this last weekend and it's okay now.
Hmm.
So
Hmm. Hmm.
being having your primary relationship, that's the words I use for it, Robert, primary relationship be central in
Hmm.
your consciousness. I just think is a tremendous aid to healing. And
Hmm.
I've had really
And
good luck.
and for our listeners who might not understand that phrase, could you explain a little what that means? Primary.
Sure.
Uh,
The What Alexander found was, when he was sort of like this,
mhm.
when he was grabbing in this neighborhood,
Mhm.
problems ensued. So the relationship between your head and your spine, if it can be as open and dynamic as possible so that you can constantly rebalance. Your
Right.
spine's moving, your head's moving,
Mhm.
you're rebalancing, you're refreshing your relationship to the earth all the time, things become easier. So
Right.
it's up in here. I mean, you've run into that with the surgery that you underwent.
Well,
Much
sure.
the
Yeah.
same way.
Yeah.
Yeah.
Um, and that Alexander used the phrase primary control to
Right.
talk about this area. But by putting your attention here and maybe on your core as well,
Yeah.
the knee, the leg, your legs and your knees uh, figure out how to fit in with that,
Yes.
basically. Because
Yes.
the,
Well
the
said.
inclination would be to put your attention on that knee, right?
Right.
Because it's calling out to you all the time. But yeah, any other things that were helpful from an Alexander
I
technique
think it's
point
a
of view?
very early on, working with breath was. That's really sort of getting a little away from where the Alexander technique is. The but it the day or two right after the operation, was very distracting, just
Mm-hmm.
because of pain and this and that and narcotics and blah 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 blah. And
Mm-hmm.
so having breath as a reference to go back to, was the most effective, for me.
Mm-hmm.
It also helped with the fear. The first couple of days after I got home, I'd go to sleep and I'd wake up in a sweat like an hour and a half later, because the last time I went to sleep, they cut open my leg, and I was
Right.
still carrying the residual of all of that.
Hmm.
And breath helped me through that as well.
Hmm.
That's all seems to have, finished by now, which is, quite encouraging.
Hmm. And as you move into more what I guess we could call a later phase of
Yeah,
recovery, because you are mobile and you're able to
yeah.
do, I assume, quite a few ordinary activities around the house,
Oh,
right?
let me interrupt you. Yeah, yeah. My one of my big days was then when I could put my pants on without leaving them on the floor and stepping into them. You know,
Yeah,
when I could lift
yeah,
my leg enough that I could put
yeah,
them on more or
yeah,
less normally. So small victories, man. Those are great.
yeah. So at this point, how are you using Alexander ideas to continue
Yeah,
the
there's
process?
one a way of folding and unfolding that Alexander technique is called monkey. It's a
Hmm.
way of, I'll just stand up for a second, coming down and going up.
Right, lowering the height of
Lo-
your head, let's
right.
say,
Yeah, lowering your butt and
by
then,
bending your knees, hips, and ankle joints
yes, right.
in a coordinated way. Right. Yeah.
Yeah, in a coordinated, gentle, and complete way.
Right.
That's been as not exactly an exercise, but really sort of a way of doing things. Uh, to do that as cleanly as possible. And for me, particularly, remembering that when I bend, I don't bend like this, but
Uh-huh.
rather like that, with everything is spiraling through my
Spiral,
legs.
because your musculature is to a large extent spirally,
Right. And then as
whatever
you
that.
go
Yeah. Yeah.
lower and lower and lower, the molecules are and the little strands are and all of that,
Right.
so that we live in a curvaceous world through my legs, and
Right.
springiness is what's happened.
Right.
I think that's what's put me well ahead of the game as well. I'll be
Well,
talking
it's
to the,
interesting that I can see how using that monkey, as it's sometimes called,
yeah,
sometimes it's called position of mechanical advantage. I think there are various
yeah, yeah. I mean,
terms
sometimes
for
I'll
it.
say position of maximum possibilities.
Yeah,
Yeah,
that too. That would be especially important for the kind of surgery that you had, and because it's getting you to do a kind of movement that is somewhat connected with lots of other normal kind of movements, like walking or bending over, or yeah,
right.
it's a pretty,
Yeah, the
yeah,
activities of daily life. Yes, absolutely,
yeah, yeah.
absolutely.
So we're running a little bit towards the end of
Yeah.
our time frame, but is there anything else that you'd like to say, or anything that you would like to say to someone who maybe is about to have knee surgery, that would be useful information for them?
Yeah, I spent probably 4 months trying to do exercises to avoid this,
Mm-hmm.
and going through those made my recuperation a lot easier. So if you're going to get this kind of surgery, uh, prepare yourself physically as completely as you can, because the recovery is difficult. It's doable, but it's difficult. I've had really good results. I know
Mm-hmm.
other people whose recovery is stretched out a lot more.
Mm-hmm.
We'll see what happens. I expect to be playing tennis again soon. First
Mm-hmm.
easily and then at full speed. And I expect, to be able to do all that twisting and turning kind of stuff. But I haven't done it, and I won't do it until the surgeon says it's okay. You can,
Sure.
because you can
Yeah.
go too far, and
Mm-hmm.
I don't want to take the risk of doing that. But
Well, that's, yeah.
preparation, preparation, preparation. It
And
really,
just
really helps.
generally, what was the nature of that preparation?
Oh, these were physical therapy exercises. So there's straight leg lifts, some bent leg stuff, some
Mhm.
things to move the joint. You know, a lot of it is trying to get the fluid in the joint and all of that. But um, my tissue was too compromised, so I had to get the replacement anyway. But the buildup I did has let me straighten my leg before they expected that I could, and bend it to the degree that they want, which is 120 degrees more than what earlier than they expected that I could. So that helped. I mean, I have an athletic background, so I think that helped too. But you know, do the prep. It matters.
Yeah, and I guess the message here also is that you may be using yourself really well as, say, a person who's been a teacher for many years,
Yeah.
but you have a history, and part of that earlier history could have been some overuse or misuse that caused
Oh,
the
100% yes.
problem.
100% yes. Right.
So you don't want to kick yourself for thinking, boy, I'm an Alexander teacher and I should not ever have these kind of problems,
Oh no, that if any of
because
you think that, that is crazy.
it is crazy. But there, I have to say, there are a few Alexander Tech
Yeah.
teachers who might take that attitude. But yeah. So unless you have anything else you'd like to add, this might be a good place to bring our conversation to a close.
I can say anybody, if you want to get hold of me, look me up if you have this coming on for you. Glad to talk to you about it. Whatever might benefit you, I'm really, really happy to do it.
Oh, okay. Well, we're going to put your you have a website,
Yeah,
right?
I have a website and email.
I
Yeah.
will put your website by there'll be a YouTube version of this and then a podcast
Okay.
version. So both of those, if you're contemplating knee surgery specifically,
Yeah.
uh, send Bob an email.
I'll be
He'll
delighted to
answer
talk
your
to you.
he'll
Delighted to
he'll
talk to you.
he'll talk to you, and he may be able to give you some pretty good advice. So on that note, my guest today is Bob Leda, an Alexander Technique teacher in the Boston area. Bob, thank you so much for being on the show
Oh,
today.
Robert, yeah, thanks for inviting me too. And like I said, I hope this helps somebody out.